Hi everyone, welcome to this webinar where I'm going to discuss the fellowships in male lower urinary tract symptoms. This is a recorded video as I'm currently in Turkey attending the EAU Technology Conference. I was so delighted when Mr. Anish Pushkaran offered me to present this topic, which is very close to my heart, as I was fortunate enough to be part of an excellent HOLEP fellowship in the country. I shall divide this topic into three sections. First part is the importance of fellowship in urology training. The second part, I will take you through my own experience in fellowship training. The third part, I will share the pearls I learned and the checklist that you need before applying for fellowship training. So coming to the first part, one of the questions frequently asked is why you need a fellowship. So we know that there is enough evidence in the literature to prove that fellowship training programs improves the surgical outcomes. Also, if you are trained specifically in a surgical skill, there is a good chance that you can master the procedure. You will have the potential to become an authority in that field, and who knows, you might even invent an intervention which might be the most efficient and the minimally invasive in male lower urinary tract symptoms. Other question asked was when you should do your fellowship. Definitely it should be after the basic training. Just after completing the basic training would be ideal, but I would say that there is no time limit for a fellowship training because the field of male LUTS is evolving continuously. So whenever you want to learn a new skill that has got a significant learning curve, then that is the right time to get a fellowship training. So you should aim to get your fellowship training in a high volume center. Make sure that their caseload is proportional to the learning curve of that particular surgical skill. You should make sure that the mentors are confident in mentoring you. What you don't want is a mentor standing behind you, being nervous in each millimeter of your instrument movement. They should have the knowledge to avert any wrong step sufficiently early enough. And they should have enough experience to get you back from any difficult situation during training. And how should you approach a fellowship? You have to think about a subspecialty that is attractive enough for you to dedicate at least a year of additional training and commitment. Realize that the skill that you learn today might be obsolete in 10 years' time, so you have to constantly adapt. When you go for a fellowship training, have a realistic expectation about the learning curve. In my experience, it was very true to the statistics because I expected my learning curve to be exponential because I was a novice. But when I extrapolate my graph after my training, it was the classic sigmoid shape. Coming to the second part of this topic, the question is what is the importance of fellowship in male lower urinary tract symptoms LUTS scenario? Most of the minimally invasive surgery for male LUTS have a learning curve of ranging from 10 to 15 cases. And this applies to UroLift and Resume. I don't have a first-hand knowledge on aquablation, iTint, UroLume, X-Flow or Butterfly, so I'm not commenting on those. Traditionally, we know that TURP had a learning curve of between 50 to 75 cases for a surgeon to do it independently and confidently with few complications. And most of us will agree that recently TURP is falling out of favor to enucleation techniques. It is due to the better amount of tissue removed that results in better long-term outcomes. Any LUTS procedure that needs about 50 cases to achieve that learning curve plateau needs fellowship training. So in male LUTS spectrum, the enucleation procedures need a fellowship training. Two enucleation energy sources were described previously, bipolar and laser. But as you know, the bipolar enucleation is falling out of favor. If you refer to the EAU 2022 guidelines, you can see that the bipolar enucleation for prostate is given a weak evidence. At the same time, the evidence rating is strong for laser enucleation process. Also, there are at least two good RCTs that says holmium laser enucleation has better outcome compared to bipolar enucleation. HOLEP is considered to be the most versatile of male LUTS procedures because if you have to learn one skill that can cover all sizes of prostate, then learning the laser enucleation will make that difference. You don't have to worry about the size of the prostate once you learn HOLEP. You can focus on the patient, his IPSS, flow rate and bladder scan, and if needed, on bladder diary, flexible cystoscopy, and urodynamics as appropriate. I'm happy to share my experiments with fellowship training. I have been in good and bad fellowships. I started with a bad experience because of my naivety, because I was excited to be part of a fellowship program. I didn't do my homework, didn't pay a visit to that hospital before I applied. I didn't ask much about that fellowship during my interview because obviously I was excited. I took things for granted. I thought getting that fellowship itself is a blessing, and I should agree that I was carried away by the name of the institute. I can't blame anyone else for that, but just me. So, without wasting my time, I left the place as soon as possible, just respecting all the contract agreements. So, when I applied for the next fellowship, I was prepared well. By that time, I knew that my passion was to learn HOLEP. I looked around for a high volume center in HOLEP, spoke to lots of people in our fraternity, and I came to know about the Lieutenant Dunstable HOLEP Fellowship. And I knew that the mentors there were training consultants all over the country. So it was a big tick for me. During the interview, I realized that the team is doing more than 250 cases per year of HOLEP. There are 2 experienced mentors who has done more than 1600 cases between them. They have audited their work meticulously. There are 2 to 3 theatre sessions per week. And most importantly, the HOLEP trainees' theatre sessions are protected. So if anyone else wants a hands-on on HOLEP, the mentors would inform me beforehand and made sure that I was happy about it. And the team gave me freedom to talk to the waiting list coordinator to arrange the list so that my training went well. And during the training, I had an intraoperative checklist where in an Excel chart, I recorded all the objective and subjective data possible. The objective means the number of cases, the volume of prostate, the time of enucleation, time of mosylation, the weight of enucleated tissue, like that. And the subjective ones were my feel about the training, my confidence on the training, things like that. So to summarize, the take-home messages are, you should have a checklist before applying for the fellowship. You should assess yourself, assess what is your passion, and see if that surgical skill needs more than 50 cases to achieve the proficiency. In that case, it needs a fellowship training. Take your time and search for the best fellowship. Search around, talk within your specialty, and once you shortlist some programs, speak with the people who has been through that fellowship before. Speak to at least 3 to avoid any bias, and focus on 1 or 2 of those fellowships, and talk to the mentors of those fellowships. Ask about how many cases they do per year, how many cases they have done so far, have they audited their outcomes, and most importantly, is your fellowship training theatres protected? And extrapolate to see if you can do at least 100 cases in a period of 1 year. If everything ticks, then apply for the fellowship. And earmark 6 to 12 months to learn that skill. Nothing else matters during that time. And once you are in the team, it is important that you have to have a good rapport with the team. You should have an excellent professional relationship with the team, your mentors, the other consultants, secretaries, nurses, junior doctors, most importantly, rota coordinator and the waiting list coordinator. Coffees and toffees might help, but the most important thing is your harmony within the team. If you want to know more about Lieutenant Dunstable Hospital HOLEP Fellowship, I'm happy to give you more information. I'll leave my email in the description of this video. Best wishes.